Sussex Rehabilitation Centre. Welcome video. Sussex Rehabilitation Centre is located in the main building of Princess Royal Hospital in Haywards, Heath, West Sussex. Sussex Rehabilitation Centre has two wards, New Timber Ward and Linfield Ward. Each ward has 3 bays and side rooms. Each bay contains up to 6 beds. Sussex Rehabilitation Centre can also be called the SRC. Whilst at SRC, every patient is allocated a named consultant who will overview their rehab. The SRC has a wide range of specialist staff, including physiotherapists, occupational therapists, speech and language therapists, dietitians, clinical psychologists, and a counsellor. These teams work with each other and the medical and nursing staff and aim to provide a high level of specialist care. What specialist staff do? A physiotherapist can support you to reduce stiffness, increase mobility and movement, and maximise function. An occupational therapist will help you to regain independence in as many areas as possible. Speech and language therapy will focus on communication, eating and drinking, and swallowing. Dietitians will assist with advice on food and nutrition. Clinical psychologists can assess, measure, and manage a range of psychological issues, for example, memory, mood, or communication. A counsellor will help with issues relating to mood or well-being. There is also an activities coordinator who will help engage patients in social activities. Goal setting. Early on in the rehabilitation process, realistic short-term goals are set. These are the aims that are important to the patient. Neurological rehabilitation cannot take away damage, but it will guide recovery. The Sussex Rehabilitation Centre will help you to adapt to the changes caused by your illness or injury, and it can help the natural process of recovery. Travel. You will be transferred to the SRC via patient transport. Arrival. When you arrive at SRC, you will be shown to your bed and shown where to put your belongings. You will have access to a pair of headphones for listening to the radio or TV by your bed. Family and friends can call you on your bedside phone, which is free to register, or mobile. SRC, a walkthrough. You will enter SRC from a lift. You will then enter the hallway. You will then go to Linfield Ward, or further down the corridor to New Timber Ward. There is no difference between New Timber Ward and Linfield Ward. They are both the same. They both have bays and side rooms. There is also a kitchen and a day room. Here is the gym. You may spend some of your sessions, such as physiotherapy, here. Here is the counselling room. For the daytime, you will need comfortable clothes, supportive shoes, and you may need shorts for physiotherapy. For the night time, you will need pyjamas, slippers, and a wash bag with toiletries. Your relatives or friends will have to do your washing at home. If this isn't possible, then other arrangements will be made. You may also bring something with you from home if this would help you feel more comfortable. For example, an ornament or a picture frame. Any electrical items that you bring with you will need to be checked as part of our Health and Safety Trust policy. Please consider what you need to bring with you, as we are unable to take responsibility for the safety of your personal belongings. Whilst you are at the SRC, you will be assessed by our physiotherapy, occupational therapy, and dietetic teams once you have been admitted. If applicable to your condition, you may also be seen by our speech and language therapists, psychologists, or counsellors. Assessment of the above will take place within the first week of referral. Therapy within the SRC is held from Monday to Friday. We will ask for your consent for all treatments before any therapy starts. We will produce a weekly timetable in which you can expect physiotherapy, occupational therapy, and speech and language therapy. Each timetable is tailored to your specific care needs and will be discussed with you. Food and drink. Breakfast, lunch and supper are at scheduled times of the day. You will not have any sessions during meal times unless they are meal related, such as a cooking session or a swallow assessment. Friends and family. Travel. For visitors, there are buses that stop outside the Princess Royal Hospital. Visiting hours. The visiting hours are between 3 p.m. and 8 p.m. every day. Visitors will be asked to leave the ward during mealtimes. COVID-19 may affect visiting times and restrictions. Make sure to check before you come. Discharge and length of stay. The length of stay at SRC is varied. It is usually between 6 to 8 weeks, but it is different for every individual. When you leave SRC, you may go home to further rehab or a placement, such as a care home. This will depend on your care and rehab needs. Thank you.